Hi everyone, my name is Lilian Momina and welcome to my YouTube channel. Today I want us to discuss about prediabetes. So diabetes is basically elevated blood sugars beyond the normal or average levels. So you find that your circulating blood sugar is higher than it's supposed to be. So there are several factors that predispose one to diabetes. We have maybe age, where when you're above 40-45 years, your metabolic system slows down, and this will predispose you to maybe insulin resistance, and this will predispose you to diabetes. Insulin is the hormone that is charged with the activities of controlling blood sugar in the body. So if you become insulin resistant or your insulin production goes down, you be at risk of being diabetic. So, and this happens as you age. So that is one of the risk factors. There's also genetic. If you have a family history of diabetic, maybe your mom or your dad, they have been diabetic, or there's a history, then there's a high chance that you might develop diabetes in the future. So you see, you want to make sure that you do a lifestyle that does not expose you to diabetes. So there's also the aspect of being hypertensive. If you have high blood pressure, or again, if you have a history of that, or cardiovascular diseases, all these, they are comorbid. So also be at a higher risk of developing diabetes than someone who is not. If you rarely work out, if you're in activity levels, your sedentary lifestyle, then this will make your chances of getting diabetes also high. And if you maybe smoke and drink too much, you also increase your chances of being insulin resistant and being diabetic. If your dietary habits are poor, if you eat too much refined sugars, if you eat too much carbohydrates, excess carbohydrates than your body needs, if you're not properly hydrated, if you're on drugs, all these factors that will predispose you to diabetes. Prediabetes is a state whereby you're producing too much. There's high blood sugar, but it's not high enough to be termed as type 2 diabetes. There are different types of diabetes. I haven't mentioned type 2. We have type 1, we have type 2, and we have the gestational diabetes. So in the past, type 2 diabetes was not, it was a bit rare. It was a disease that, as I have said, it was a disease that affected the elderly, but unfortunately, currently it is even affecting young adults, which is very, very unfortunate. So we need to adjust our lifestyle and dietary habits to make sure that this stops. So being pre-diabetes, what are some of the symptoms that you want to check or to self-assess yourself? One is being overweight. With the right metabolic balance, with the right production of hormones in the right amount, and your good dietary intake, your human body is able to maintain the same weight for a period of time. So if all of a sudden, like, you have been, your lifestyle and dietary habits have been, then you start gaining weight, and it is not intentional, and you're not pregnant, you're not like adjusting your lifestyle towards maybe like activities that would make you gain weight, then you need to like go have your sugars checked. And then another after that is basically you've done your annual checkups and you found that your sugar level is higher than normal, but it's not yet diabetes. Then you are in a pre-diabetes state. If you experience too much thirst, too much urination, frequent urination, it means there might be too much levels of blood sugar in your system. Now you lose fluids more. And then you see there's also the act of excess hunger, because you see, when like you're frequently eating, there's overproduction of insulin. Insulin is a storage hormone, so it will trigger the conversion of the circulating glucose into fats, and then you see your cells will be starving. So your cells will not feed on the sugars. They will not feed on the sugar, so you'll see your signals, your body will be signaled to you for you to ask for more. So you will get more hungry, and you'll find that you will eat more. And this is dangerous. This is the easiest way to get from pre-diabetes to diabetes. It's to activate this. This is dangerous. So you need to work on this. So what are some of the things that you can do to transition from being pre-diabetic to healthy? Unfortunately, a big percentage of our population has diabetes, is in a pre-diabetic state. It is in the rising. Diabetes is a chronic disease that is rising daily, despite of the many intervention, the many educational talks, the many trainings that we have in the country. So we need to make sure that we work towards not having it, because diabetes can be irreversible. So you see, you don't want to get to there, so you want to reverse it before it gets to the diabetic state, whereby now your pancreas cannot even produce any more insulin, or it cannot. Your body is insulin resistant. The way the metabolic balance is, if you're in a good metabolic health, you're supposed to be producing insulin in line with the amount of foods that you're taking. But you see, this again, you don't want to overproduce the insulin. If you put in yourself in a position whereby you're overproducing insulin, then you're predisposing yourself to being insulin resistant, and this will make you even develop diabetes faster. And also other things that will make you transition from being pre-diabetic to diabetic, and that is sugar intake. If you're going to take one thing from this video, please take away, eliminate sugar. Sugar is toxic. Table sugar, processed refined carbohydrates, they are terrible for you. They are bad for you. They are bad for your health. They are bad for your metabolic health. They are bad for your insulin function and all that, and they will easily get you from pre-diabetic to diabetic state faster than you think. They trigger inflammation. All foods, all the things that trigger inflammation, let's say foods in terms of, we have sugar, we have processed and refined carbohydrates, we have the omega-6 fatty acids, we have the vegetable oils. Unfortunately, all these factors that trigger inflammation will easily transition you from being pre-diabetic to being diabetic. You see, fortunately for us, this state, you can stay in pre-diabetic state for a very long time, from 10 to 15 years. But if you see, because the body is also trying to fight and make sure that it maintains this balance, your pancreas is also trying to make sure that it is producing insulin in demand. But if you alter some of your lifestyle habits, you will be in a position to reverse this. The pre-diabetic state is very, very much reversible. So you need to make sure that you attack it. You attack this before it becomes irreversible, and that is the type 2 diabetes. So what are some of the things that you can do to reverse pre-diabetes? So one, you can adjust your lifestyle. One, you start working out. Physical exercise is very, very good. It improves insulin sensitivity, it improves fat burning, it improves all that, you see. So when you start burning fat, and when you improve insulin sensitivity, you basically improve how your blood your glucose, your blood sugar is, and this will help you reduce the chances of being diabetic. And then there's also a dietary adjustment. If your diet is full of processed refined carbohydrates, you need to work that out. Eliminate sugar. In a pre-diabetic state, you see there are certain foods that you need to, those inflammatory foods like dairy. Do a healthy, balanced diet. In your meals, when you're preparing your meals, make sure that you avoid refined carbs, you avoid fried carbohydrates like the fries, the crackers. You do more of boiled, like arrowroots. In Kenya, we have ngwashe, we have ndoma, we have cassava, we have muhogo, all those. Make sure you substitute all this for things like maybe bread, things like mandazis and all that. Do a substitution of the carbohydrates that you're taking. Make sure that you're doing complex carbohydrates. Why you want to do complex carbohydrates is because they have adequate amounts of fiber, and these amounts of fiber are good for your gut. So they will feed your gut with the right prebiotics, and then they will help. You see, when you're recovering, when you're trying to improve the way your system is metabolizing nutrients, you'll want to work on your gut. So when you're taking whole grain carbohydrates, you're also helping your gut. So, and then also increase your fiber intake, increase your fat intake. So the healthy fats, don't do unhealthy fats. The healthy fats, we have the avocado, we have the quinoa nuts, we have the fish oils, we have the omena, the samaki, the lean meats, we have all those. You can also do a diabetic diet, have a variety of meals, and then do your fruits, your vegetables. Green leafy vegetables are great if you're trying to increase insulin sensitivity. You see, the green vegetables, mostly they are rich in fiber. What fiber does? Fiber improves satiety, fiber improves fermentation, fiber reduces the frequency of foods that you're going to eat. So you see the amounts, the insulin spikes that are a bit less. So if you have to do a snack during the day, maybe do a green smoothie. It might not be tasty at first, but test glands will adjust to it. So make sure that you're doing, you should increase on your fiber, then control your stress. If you have hypertension or if you have high stress levels, make sure that you try and work towards techniques that will help you reduce stress levels. Do aerobics, do meditation, do yoga. You can do breathing exercises. They're also great to get you more oxygen in your system, and this will improve your metabolism. So make sure that you do that. And then you can also do intermittent fasting if you're in a pre-diabetic state. As the mantra, as I always say, start gradually. I did a link on how to start, or how to things that you can do to make your intermittent fasting a bit easier, a bit more manageable, and I'll definitely link that up so you can check it out. So you can also do intermittent fasting. It is great for insulin control. It is great for reducing resistance. Basically, being pre-diabetic means that your insulin function is altered, and either your pancreas is not producing enough insulin, or your body is becoming insulin resistant slowly. So you see, these are the two conditions that will be altered very, very well when you start working with IF, intermittent fasting. When you start working with intermittent fasting, definitely if you plan well, if you do like the healthy plan, you'll definitely reduce the amount and frequency of feeds that you're doing in a day, and this will reduce the number of times that you're spiking insulin. So you can start slowly by 16-8, and also make sure that your meal combination when you're doing intermittent fasting, there are foods that are rich in fiber, low in processed carbohydrates, do not do pizza, do not do chips, do not do mandazis, do not do mikate and all that. There are certain substitute, and you will adjust to it. You will. Your taste buds they are adjustable. And then you can also do wheatgrass. Wheatgrass is a great, if you're doing intermittent fasting and you're also finding it difficult to maintain the fast, you can do wheatgrass. Wheatgrass is great. It will provide you with fiber, it will provide you with nourishment, and it will make you less hungry when you're fasting, so you can maintain a state of whereby you're not spiking your insulin. So you see, you're giving your body a rest, a period of rest, whereby you are like, let's say your system was, you wake up at 6 and then you start your tea at 6, so insulin spikes. You come at, when it's a bit to go down, you get your coffee at 10. Your coffee and your mandazi. In Kenya we don't snack tea alone. You're working, so according to you're working, so you have to do tea and mandazi or tea and chapati. So you've done from your 6 a.m. you did breakfast at home. Now the insulin was coming down kidogo, then it's 10. You need to do your tea, and again you do your mandazis or your chapati or whatever you're doing, then your insulin spikes again. 2 hours later or 3 hours later, the same routine goes up. You see, the number of times that you're spiking this insulin is very, very bad, and it will cause you more insulin resistant than good. So make sure that when you're doing your IF, also adjust your meals to make sure that you reduce the frequency of meals in your planning. So you can do a healthy, like let's say for instance, just make sure that you watch the video on IF. It will really be of help. Thank you for listening.